process anterior, squamous part upwards, squamous part upwards, tip of the mastoid process downwards. This is the anatomical position. Okay, tip of the mastoid process forward medially, squamous part upwards, forward, zygomatic forward, tip of the mastoid process downwards.
স্যার হসপিটালে তো এটার মধ্যে দিয়ে দেবে নাকি এটা?
না এটা থেকে petromastoid part. So petrous part and mastoid part. Clear? Squamous part. This part is a squamous part. This part is squamous part. So petromastoid part or petrous part, mastoid part, squamous part along with zygomatic process. Squamous part, zygomatic process. Okay, you can say separately. Petrous part, mastoid part, squamous part,
zygomatic part.
Yes, squamous part along with zygomatic part and
Mastoid part.
This part is tympanic part. This part is tympanic part. Okay. This part is tympanic part. Where the external acoustic meatus lies, this portion of bone is known as tympanic part. Okay. And have a styloid process. Styloid process almost. This one is the temporal bone. And this one is the styloid. Anyone have any temporal bone with styloid process? Well, I use styloid process. Styloid process is in this portion.
That's more like the videos we show.
Okay, this one is This one is mastoid process. Okay. And here lies the styloid process. Mastoid process, and just in front of the mastoid process here lies the styloid process. This one is the styloid process. Clear? Mastoid process, stylomastoid foramen tam ekhan thake. Stylomastoid foramen eta.
Foramen in between.
Okay.
Styloid and mastoid. Mastoid, foramen, stylomastoid.
This one is the styloid. Okay. Lots of information about this bone, but you have to know at least the parts and important attachment, important relation. Okay. So now first come to the squamous part. This portion is the squamous part. Squamous part up to this. This part is the mastoid part. Okay. So this part is the squamous part. Squamous part have an external surface. This one is the external surface, and the internal surface or cerebral surface. Internal surface or cerebral surface. A superior border. This one is the superior border, and the anterior-inferior border. This portion is anterior-inferior border. This portion is superior border, external surface and internal surface. Now come to the superior surface. External surface. This one is the superior border. First come to the superior border. This superior border articulates. This superior border. This one is the superior border.
Parietal.
This superior border articulates with the
Parietal.
squamosal border of the parietal border. This one is squamosal feature. This one is superior border. And anterior-inferior border. This portion is the anterior-inferior border.
Greater wing of
This portion
sphenoid.
is the anterior-inferior border. So this one is the greater wing of the sphenoid. Greater wing of the sphenoid, anterior-inferior border. So superior border articulates with the parietal bone, and this anterior-inferior border with the greater wing of the
sphenoid.
External surface. From the root of the zygomatic process, a crest goes backwards parallel to the external acoustic meatus. Okay, about 2.5 centimeter above or 1.5 centimeter above the external acoustic meatus. This one is known as suprameatal crest. This one is known as suprameatal crest. Okay, suprameatal crest. In this suprameatal crest, the galea aponeurotica attached here, temporalis fascia. Above the suprameatal crest, this area is covered by temporalis muscle. Okay, so this area is covered by temporalis muscle. Suprameatal crest, here lies the galea aponeurotica and temporal fascia. Okay, suprameatal crest Okay, this area is covered by temporal muscle. This part of the temporal fossa. Okay, okay. And here in the suprametal crest, here lies the gallia aponeurotica. Gallia
Aponeurotica.
Okay. And in the posterior part, here lies the auricularis posterior muscle. Here you can see this was marked by red color. Here lies a groove. This groove is for middle temporal artery. This information is not important for you. Okay. So this groove is for middle temporal artery. Okay. Here, just below the suprametal crest, here lies the suprametal triangle. Here lies the suprametal triangle. Here lies the suprametal triangle. This suprametal, why this suprametal triangle is important? Because if you introduce a cannula by piercing the bone, it will go to mastoid antrum. This portion is suprametal triangle, and suprametal triangle is guarded anteriorly by a suprametal spine. So this small bony projection is suprametal spine. Okay. This small bony projection is suprametal spine. Suprametal face, suprametal triangle, suprametal spine. Okay, so external surface of suprametal crest, triangle and spine. And this area is the temporal fossa. So attachment to the temporal muscle, and here attachment crest, attachment of the gallia aponeurotica and temporal fossa. Now come to the internal surface. This area, internal surface, that means this area. Here lies the frontal lobe of the brain. Here lies the temporal lobe, and here lies the occipital lobe. Here lies the cerebellum. Okay. So here lies the temporal lobe of the brain. So cerebral surface. This part is the
petrous part.
This part is squamous. So this suture, name of this fissure is petrosquamous. Here lies the petrosquamous sinus. So petrosquamous sinus lies here, and you can see a groove of a artery or vein. So this groove is for
Medial meningeal.
This group is for parietal and frontal branch of middle meningeal artery or sinus. Okay. This group is for parietal or frontal division of the meningeal artery. So this internal surface have temporal lobe, relation of temporal lobe, petrosquamous sinus and fissure, and this group is for
Parietal and temporal.
branch of the meningeal artery. Okay. Now after covering the squamous part, I will cover up this process. This process is zygomatic process. So this process is this process up to this part. Okay. So this portion you can feel here. This portion is subcutaneous. Here you can feel the bone. This part is a subcutaneous. This part is really subcutaneous. Okay. This zygomatic process have an anterior part, and a posterior part. This posterior part is flat. So this posterior part have a superior surface and an inferior surface. Okay, have an inferior surface, have a superior surface. This posterior triangular part have a superior surface and a inferior surface. Clear. This anterior part has a superior border, inferior border, medial surface and lateral surface. This anterior surface has a superior border and inferior border, medial surface and lateral surface. Okay. Now come to the posterior part. This portion, superior surface is quite concave. Okay. This sinus, name of this sinus was petrosquamous sinus. Here sometimes maybe the small openings for the petrosquamous sinus. Okay. Now this inferior surface is very important because inferior surface have two roots, anterior root and posterior root. This anterior root is quite thick. This anterior root is quite thick. This root is known as articular pillar. Okay, articular pillar or articular tubercle. And this one is the posterior root. Posterior root is known as postglenoid tubercle. At the posterior part, it have a tubercle. This name of this tubercle is postglenoid tubercle. This one is posterior root and this one is postglenoid tubercle. It forms the posterior boundary of this articular part of the mandibular fossa. This one is the postglenoid tubercle. Okay, so anterior root is the articular pillar and posterior root have postglenoid tubercle. These two meet at a tubercle. This one is known as tubercle of zygoma. Tubercle of zygoma. Tubercle of zygoma.
এটা তো আর্টিকুলেট টিউব
না, this one is the articular.
কোনটা
This one is articular tubercle. This one is postglenoid tubercle.
Oh, okay.
This one is tubercle of zygoma. This tubercle of zygoma, this portion of tubercle of zygoma, here lies
articular tubercle.
this part is the tubercle of zygoma. Temporomandibular joint is very important. The lateral ligament of temporomandibular ligament joint, this ligament attaches at here. Tubercle of zygoma. So this tubercle of zygoma, why it is important? Because the main ligament, that is the lateral ligament of temporomandibular ligament attaches here. Clear? So this tubercle interior surface of anterior root, posterior root. Anterior root is known as articular pillar or tubercle. Posterior root is guarded posteriorly by postglenoid tubercle. Both the pillar, anterior pillar and posterior root meets at the tubercle of zygoma. Now comes the anterior.